Hi guys, it's live time again, and today we are going to talk about how to top your BDS examinations. And with us, be having the co-founder or the founder of dentistry, Taughtwell Academy, Dr. Ketaki Pawar Chavan. She has this aspiration that the way education is taught in dentistry completely changes. She realized that when she was studying BDS, you always had to study from the textbooks and you could not imagine how things are actually in reality. So her aim is to change how we see dental education. So Totwell Academy creates a lot of amazing videos, content through which you can go and study everything beforehand. Her aim is that dental colleges should be used for discussing clinical cases and understanding more about dentistry. So let us welcome Totwell Academy founder uh, Dr. Ketaki Pawar Chavan. Hey, how are you?
I'm fine. How are you?
I'm fine. Amazing to see your launch of the new app. And between your busy schedule, you've taken your time to come and join us. Thank you for that.
Yeah, it's my pleasure actually. It's okay, I'm not that busy.
So you have told me that you were never a topper, and your aim is to see that people can top easily, they can do well in their education. So today's topic was about how to crack your BDS exams, that is how to top it. But we have a few questions. What prior to the BDS exams? So if you're game for it, we'll ask two questions related to that. Yeah. So the first question is, if I have a particular subject and I have multiple books which I have to read from, how do I go about selecting which book to read and how do I plan?
So yeah, that is a very common problem, especially in dentistry, is that for one subject you are ideally required to read 4 to 5 textbooks, which we actually don't have time to read. So what we can do here is we can select a main textbook for us, which we are going to buy for us. And whichever book is suitable for you, you can buy that and make it your main textbook. And the rest of the books are there in the library already. You don't need to buy it. You can just refer to them, see what extra points are given in those books, and then you can write them the extra points on sticky notes and stick them to your main textbook. So in that way, the main textbook will have everything that the other textbooks are having. Whatever extra points are there, which are not there in the main textbook. Also, some diagrams are given in other books differently or in a better way. So you can make a notebook for that and draw the diagrams from there. So the aim is that you don't have to go back to those books again because you don't have that much time to revise later on. So that is one technique which will help you reduce the number of books that you need to refer to.
Understood. Now this is about start making books. You told about sticky notes, have a separate book. So do you advise going in and making your own notes, or what is your opinion about notes as such?
Yeah, the next point after reading a textbook is that you should go for notes. But I don't recommend the traditional note taking method that is where you write 2 to 3 pages or even 4 pages. You don't have any limit. So that becomes another textbook later on to refer to. So what I suggest is that you create one sheet and you have to limit yourself to that sheet only, and you need to write out the main important points that you have gathered from all of these textbooks into that summary sheet. So that will be very easy to revise from when it's time for exams. Even for NEET preparation, that sheet will be very useful.
Got it.
After that,
So
what
you're
I
telling
recommend,
basically one
yeah,
sheet with only main points to be there.
yes,
Okay.
that's just one sheet. And what you have to do with that sheet is that you need to implement active studying to it.
Okay.
You need to get a
So what is that
whiteboard and
actually?
copy. So what people think about it that is that you making notes is active studying. People think about it in that way. But active studying is when you actually have to get up from your seat and actually have to involve all of your senses, that becomes active studying so that you don't fall asleep while reading. So what one can do is invest in a whiteboard, and whatever you have written on the summary sheets, you just need to copy all of that without looking at the sheet to the whiteboard so that it's right there. At least for a few days, it's right there. Whenever you pass by it, you can revise that thing. And in that way, the
Oh, that's a
subject
very easy
becomes,
technique.
it's very easy to recollect in that way, I think.
Understood. No, that's a very good idea. So when it is there, you're just going through it, so you're continuously revising what you have read recently. So that's a very nice tip. So now this is before the exams. Let's get back to the meat of the discussion, that is
Yes.
how to crack your exams. Okay. Now there are different questions which are asked in a paper. I might be confident of answering the question number three. So do you advise me answering based on which question I'm confident about, or I answer in the order in which it is asked, like go to one, two, three, rather than just randomly answer questions?
So, what I think is the aim is to make the answer paper readable, easily readable for the person who is assessing it. So one should think of his point of view and make it easy for him. So I think we should go order wise. And if you know that you don't know the answer of one question, say number two, I don't know at all, then you can just skip it. Or if you know that you will be able to recollect it later on, you can leave a page for it. So in that way, I
Okay,
think we should go by order only.
understood. So that is, it is easy for the person who is correcting your paper to
Mhm.
digest, and that would make him feel like giving better marks.
Yeah.
Now, one problem I've heard commonly is, how do I manage time? Sometimes for a two marker or a three marker, I spend a lot of time writing 1 hour or something, and by the time I reach a question which has 10 marks or 20 marks worth, I just do not have time. So how do I manage my time?
Yeah, we often get engrossed in writing the long answer questions and then we are not able to give justice to the others. So it has happened to me also that I was not able to answer a few questions. In the end, I found out that I completely forgot answering these questions. What happens in exam time is that there is a mental fog because of all the sleep deprivation. And so what I suggest is that before starting to write your exam, you should set aside a particular time for every question. And then when that limit is crossed, then you should stop writing it and move on to the next question. And in the end, you should have 30 minutes free where you can go back and finish if there is something left out. And in that time, you can also check if you have totally skipped any of the questions because you couldn't see it, because that has happened to me. So I think it could happen to anybody else also. And so what I did is in
Understood.
the last 10 minutes, I hastily wrote whatever I could recollect and in the order. So I passed. It's a good thing. But I don't recommend that it happens to anybody else. So always leave 30 minutes aside in the end for going back.
Okay. So you should plan how much time you're going to spend per
Yes.
question beforehand. So it's a two marker, how many I'll be spending maybe 5 minutes. So as soon as that 5 minutes is over, I have to move to the next question. Now
Yes.
you're telling me to have a timer and do this. But imagine I know a lot of content on certain questions and I know very less content in a given question. How do I manage what all I should write for a given question? So for a two marker, I might have knowledge of a 10-mark question. So how do I curtail that?
Then you can decide it beforehand that you're going to give that much time to that short answer question. If suppose you know more about something, then you can give more time to that question. So in that way, you can customize it to your liking, but you should also always have a limit. Otherwise, we get carried away and then we can't move on to the next questions.
Understood. So other than the timing part, okay, if there is certain questions I need to answer, is there a particular order in which you tell, any tips in writing that answer so that I get more marks for the same answer?
Yeah, for long answer questions and also for short answer questions, there is a particular format. And if you follow that, even before you get the question paper, 40% of the answers you will already know what you're going to write. So that is the method that I have, is that you should divide the answer into four parts. introduction, then comes the main answer, then comes the diagrams, which should be included in the main answer, diagrams and flowcharts, and lastly, recent advances. So for introduction, that is the beginning, and for the end, one can create a template, as in if you open oral medicine and there are sections, temporomandibular joint disorders, maxillary sinus disorders. So for each section, you should prepare an introduction template, which you can write for any question that comes from that major topic. So I'm not recommending
Understood.
it for smaller topics. Just if you get a question from TMJ, then you can have the template and you can write it as an introduction. You don't need to see what the question is. If it is from DMJ, you write it. And then comes the in the main answer, then you can specifically answer what is actually asked in the question. And in the main answer, I recommend that you draw a lot of diagrams and flowcharts. So that will reduce the amount of time you need to spend on long answer questions. If there is something like a procedure that you have to explain, it will be easily readable by the person who is assessing that. And it also shows that you know your subject well if you are able to draw the diagrams and make it more presentable in the form of flowcharts. So that is
Understood.
one way. And recent advances, although uh, it is not expected from undergraduates, but it is the thing that will set you apart from the other papers that are there and actually give you a shot of topping an exam or scoring the highest marks in that subject. So even for that, you can have a template which you can apply to that particular section. If anything is asked from that section, you can apply the template and write the recent advances for that. And you
Understood.
can even take help of a PG student for that. They can review whatever you have written, whether it is relevant to that section or not. If there is something about TMJ, then you can go and see on Science Direct or Google Scholar if there are some latest studies have come out. That will show that you have gone the extra mile. And I think it will really impress the person who is assessing.
Great. That's great bit of advice. So for the theory paper, your first advice was you should answer question wise so that when the examiner is checking, it is easy for him. So if you're not sure of a given question and you're not going to answer it, then leave it blank. But if you're planning to come back to the question, you better leave some space. You need to manage your time according to you by primarily before the exam, deciding how much time you're going to give for a 2 marker, for a 5 marker, or 10 marker. And in case you find a question which you are sure you're very confident about and you want to give it a lot of time, this also should be predetermined, but you should have a cutoff limit so that you do not miss out on any given topic. The other amazing advice you gave was if you're having a long answer, pre-plan it and divide it into sections. Like, for example, an introduction, the main summary, the introduction for a given topic like TMJ. If you have various questions, can be similar across the questions. Then the main question should have answers and flowcharts. And then writing advances will help you score better and top your exams because that will be the X factor in your paper compared to others. Really amazing pieces of advice out there, Dr. Ketki. So, Dr. Ketki, now this is about the theory. What about practicals? Now, sometimes we go for the exam. There are a lot of topics I've read, but the examiner tell me which is your strongest topic, and he tries getting that out so that he can go deep into it. But I have read everything superficially. So, what do I do?
So this is something one should anticipate that he is going to ask that question. And for that, you need to prepare a topic very thoroughly, like read scientific articles and be reads whatever new recent advances has come in that field. So you need to have a strong topic and you will be able to easily answer that question. And one should never say, I know everything, so you can ask me anything. Because that will show that, first of all, nobody knows everything. Even the examiner will not know. So you should not show so much overconfidence and just say whichever topic you have prepared well.
Understood. So you should preempt this and
Yes.
you should prepare one topic better as compared to others. Now what if I don't know a given answer? I just tell blankly I don't know about that topic, or how do I go about it?
So even in a clinical scenario, a dentist doesn't know the answer to all of the questions or does cannot diagnose every condition. Even he has to seek expert opinion from other dentists. So you should not feel ashamed that you don't know. You should just say that you don't know, but you will find out the answer. And the reason you should say you don't know is so that you don't say anything out of the blue or embarrass yourself in front of the examiner just to
Understood.
answer something. Just say you don't know so that you can move on and then he doesn't waste his time also.
Got it. Now, after all these tips that you have told, I apply them. What happens if I fail an exam? How do I get myself out of it?
So, one of the main things that one should do is to see why you failed, find out the reason behind it. And what I've seen most students do is that they try to avoid going out in the public. They feel really ashamed of going into. There used to be an out batch. I don't know if that is still applicable. They feel that sort of shame. But I think that you should just get yourself back up and see why you failed in the first place, and then change your methodology of studying. You need to implement all of the strategies that are there, like how to study and how to prepare. You can get your seniors guidance also. One of the things you should meet is if you should do is if you failed in cons, say you failed in cons, then you should go to that subject teacher and ask his advice how you can do it better next time. So that person also remembers that this person is actually willing to improve his scores and he will give you a great guidance, I think. And that person will be the best person to guide the student.
Great. That's
Even I
amazing
have
advice.
failed in one. Even
What
I have
happened?
failed in one of the first internal assessment. Even I have failed. So it's not a big issue. It doesn't define anything. You can still go ahead and make it big.
Yes. So we have a live exam in front of us, Dr. Ketaki. She failed her first internals, and look at her. She's achieving milestones after milestones, come up with her own app, trying to help the next generation of BDS students out there. Now, coming to this point, Dr. Ketki, you have an amazing app called Totwell Academy. Could you just give me a few details about it? How does it work? And if I'm a BDS student and I want to learn from the app, how do I get access to it?
So whatever work that I have mentioned that a student has to do, like reading from different textbooks, that is the work that I'm trying to eliminate by using Taughtwell. The student can completely rely on the videos because the videos itself are prepared by referencing 4 to 5 textbooks, all standard textbooks, and then scientific articles. And we have made it a point to include recent advances into the notes as well as the videos so that the student doesn't have to go and do that. Because in dentistry is vast and doing all that work for every topic is very difficult. So what happens is you prepare some topics really well and then you have to keep some for option. But like in healthcare, we are dealing with real patients and we can't leave anything for option. So we should be knowing everything. And to know all of the things in short time, I think the videos are going to help the students really well because it's just 10 to 20 minutes and it's done. And there was a study that was done about medical students' attention span. It was just 18 to 20 minutes. So we are getting the
Great.
video done in 18 to 20 minutes. And let's say if you had 4 lectures during the day, you can't revise all 4 topics after the lecture hours are done because nobody can do that after the college hours are done. Everybody is so tired. You can just watch the 4 videos and keep up with the work. So I
Got it.
think that if we implement that, we can, like you said in the beginning, we can replace the lecture hours with more clinical centric things to be discussed.
Got it. So how do I go to this app? This app is available both on Android and iOS. What are the payment programs? How does it work?
Yes, it's available on both Android and Apple. And one can try for free using the dentistry bootcamp course that is there. So before you buy, you can try it for free. And all you need to do is sign up and get the free trial. We are also starting an email newsletter where we will be sending notes to whoever signs up.
Good.
So
Amazing.
there are currently we are serving the final years only, and we are done with most subjects. And whatever new subjects or videos we will be adding in the final year will be free for whoever has subscribed. Whatever new additions are there, the pricing plans are all there on the website. It's for 3 months, 6 months, and 12 months. So according to your preference, you can select that.
Good. So depending upon how close you're to your exams, you can decide whether you want 3 months or 6 months program. And whatever content they keep on adding, if you're already subscribed, you will get access to that as well. And to the subscribers, they're going to come up with notes also, which are going to be emailed to you directly. We'll just go through the questions if anyone has asked any. 1 second. Uh, there's one question. What is your advice to the young dentists out there?
Oh, that's a nice question. So, what I suggest the young dentists out there is first of all, get to know yourself, what you like and what you don't like. Just because you have done BDS does not mean that you have to keep doing it for the rest of your life if you are not liking it. Like, I am one of those people who did not like clinical dentistry, and so I got into the non-clinical field. No, and it happened by chance, but I was not really enjoying it, and I didn't know until I got into this how much I'm not enjoying that. So one of the
Got
things
it.
now, how you can know whether what you're passionate about is if you're doing something, if you are able to do it 24/7 and you don't have any problem with it. Now, a lot of people think that I work really hard and I've done this much and that much and doing that much. So now, when I work, I don't feel that. I don't feel that it is work at all. I feel like I'm enjoying it so much that it doesn't feel like work. And so, when people say that I'm working really hard, that it doesn't resonate with me. So, you should feel that kind of love towards your career. And if you have found that, then stick to it. You will be successful in it. There's a guarantee. But don't make that decision based on what your parents are saying or what your peers are saying. Just because they are starting their clinic. So we go into autopilot thinking that now I have to start a clinic. Now I have to do MDS. And that's what I did. And I admitted that I did. Sorry. I did MDS out of this only. I was on autopilot. After BDS, what is that? MDS. Okay, let's do it. I didn't think about it at all. I just did it. I'm not regretting it, but it has given me an edge over, I think, in terms of scientific study and all. So I don't regret that, but you should just try to find out whichever profession is best for you and know that you're not
Great.
stuck anywhere.
There's someone who's told your videos are extremely awesome, man.
Thank you. Thank you so much.
The next question is, should we always have a great handwriting while writing our exams? Is good handwriting a must?
Yeah, but everybody doesn't have it. So one thing you can do is at least keep a space between the letters so it's easy to read for the person and not write in a cursive because cursive is very difficult to understand. So you just need to write in a way that the at least you can understand the handwriting. And if you
Understood. So it
have
should be
good
legible,
handwriting,
it should
that's
not
a
be
plus
artistic.
point. If you have good handwriting, it's a plus point only.
Yes. So legibility is more important than being
Hmm.
artistic.
Yes. You can be
Uh,
artistic in your diagrams.
should we draw lines on both sides of the exam sheet to avoid a big answer? To narrow it down and just write in the center.
Uh, don't you think that the examiner already knows this tactic? And even with regards to that, people write irrelevant things in the answer just to increase the length and think that they are not going to read it. but it might happen that you might lose marks if you write completely irrelevant things. So better to be prepared than to write something which is not relevant to what is being asked.
Okay. Before we end, there are a lot of BDS students who are watching this. So who they're in their first to fourth year. Any advice for them?
For them, this that just that you need to enjoy whatever the 4 years you have got and treat it like a job, full-time job, where you have to be the best dentist you can, and you get this time to find out your passions as well. So you can get involved in various extracurriculars, so that you get to know beforehand whether you are fit for this career or not. That will help in understanding also. And lastly, you should always think, if you're planning to open a clinic, go into clinical dentistry, then you should imagine your mother sitting on your dental chair or any relative, and then think how much you should study, how confident you need to be. That will
And
that will be a motivating factor when you're studying.
that's a very amazing parting advice. You're the first one who's told
Yes.
that when you're studying in the 4 years only, you should imagine that once you're out, you're able to provide the best treatment to your patients. So imagine it's some of your relative who's on the chair. Uh, Thank you, Dr. Kiki, for taking out your time and joining us on this amazing session today. Thanks a lot.
Thank you. Thank you for inviting me, and you're doing great work with all the podcasts, uh, and letting people know how many options are there. This is what I didn't know. If your channel was there, I would have known so many dental career options.
But we would have missed on the amazing Totwell Academy, which is right now there.
Yes, it's okay.
Thank you. Thank you for your time.
Yes, thank you. Bye.
Bye.